Hello everyone, my name is Martin Vesan and I will be presenting Albania and United States healthcare. So some stats about Albania is that Albania's capital is Tirana, the population is around 3 million, language is Albanian, life expectancy is 79 years, and cultural makeup it's 99% Albanian, 1% is mixed with Greek and Macedonians. Right there we have where Albania is located. It's located in Balkan, where it's surrounded by Montenegro, Kosovo, Macedonia, and Greece. That's why there are a lot of Macedonian and Greece in Albania. Then we have United States. So the capital is Washington, D.C. The population is 331.9 million. Language is English. Life expectancy 77.28. Cultural makeup, very diverse, American, African Americans, Hispanic, and more. Then the death rates in Albania, as it shows in the slide, are increased by 0.2 deaths per 1,000 inhabitants in 2020, with an 8.26 deaths for 1,000 inhabitants. The death rate thereby reaches the highest value observed period. And then we have the death rates in the United States. The number of deaths is 3,383,729, and the death rates are 1,027 deaths for 100,000 population, because as we saw earlier, America has a higher population than Albania. So causes of death in Albania that are mostly known are heart disease, stroke, lung cancer, Alzheimer's disease, COPD, lower respiratory infect, stomach cancer, prostate cancer, other cardiovascular, like about heart, especially because Albania they smoke a lot, colorectal cancer, and cirrhosis. Then in America we have the ones that are mostly known. It's heart disease, lung cancer, stroke, Alzheimer's disease, COPD, lower respiratory infect, colorectal cancer, cirrhosis, and diabetes. Now we have the type of healthcare system utilized in private and public in Albania. So Albania is mostly public. There are private hospitals. They're becoming popular because a lot of doctors out of state come, and they build their own clinic, but it costs a decent amount of money to be going to a private doctor. Where US does not have a universal coverage like Albania has, and it can be defined as a mixed system where publicly financed government Medicare and Medicaid health coverages coexist with privately financed private insurances. Albania is mostly funded by the state. We don't have a lot of health insurance, so unless you are private, you're not paying anything because the healthcare is free. America is mostly funded out of pocket, private health insurance companies, Medicaid, Medicaid, and other programs or the state. Who qualifies for public health in Albania? So everybody does. There's no really exception. As long as you live in Albania and you are part in that country, you are gonna get free healthcare. Unless, as I said, you go private, then you have to pay. It's a small amount compared to America, but it's a very high amount compared to how much they make salary. Who qualifies for public healthcare and options? So Medicaid and the Children's Health Insurance Program, CHIP, provides free and low cost health coverage to millions of Americans, including some low-income people, families, and children, pregnant women, the elderly, and other people with disabilities. So even we have a graph here showing it more how it looks like. So my two proposed solution, the U.S. healthcare system is unaffordable and very expensive, and I see that from my own experience. And I think the solution for it would be make it more affordable, reduce the expenses, not charge people so much. The country can get budget from the state. I know it's like hundreds of millions, but we spend way more money in military than we should do in healthcare. And then for Albania, healthcare system is very poor and lack of equipment. Very great doctors that we have leave the country because they don't have the equipment to do the surgery or have an operation. And then these are my sites. Thank you.